The purpose of this video is to provide a training on HIV testing in the field by administering a rapid HIV test to diagnose the HIV status of a person in a non-laboratory setting. It is vitally important that the correct standard operating procedures are followed for two major reasons. Certain steps in the procedure are legally required. If you deviate from the correct procedures and times set for each particular test, you run the risk of giving your participant an incorrect result, and this could have life or death consequences. Why is knowing your HIV status important? An HIV counseling and testing is an entry point to a comprehensive treatment and care program. Once an individual has been tested for HIV, prevention can be reinforced and referral made to available treatment, care, and support services. Looking at the informed consent, prior to conducting an HIV testing, where the result will be given to the tested individual, one needs to provide an informed consent for all participants who are 12 years or older. HIV testing must always be voluntary and free of coercion. In order to make an informed decision about testing, clients should be given information about HIV acquisition and transmission, HIV risks and risk of reduction, importance of early HIV diagnosis, the HIV testing process, meaning and implications of a negative result, the window period, meaning and implication of a positive result, and information on referral, disclosure, and confidentiality. And then looking at counseling, all HIV testing should be preceded by counseling and also followed by a second session of counseling when results are being given to the client or the participant. An agreement to take the test must be in verbal and or written format using the prescribed informed consent form. Where the client cannot write or has a disability that hinders his or her ability to write, the right-hand thumbprint can be used in place of the signature if the client wishes to take up the HIV test and give signed consent. Regarding appropriateness, counseling and testing services must be appropriate and sensitive to the client's circumstances, including culture, language, sex, sexual orientation, age, developmental level, reason for testing, etc. With regard to confidentiality and privacy, all clients must be assured of the confidentiality of their test records, of the system of record keeping, and of their test results. Disclosure to sexual partners should be encouraged. However, the decision to disclose should be taken by the person undergoing the test. Looking at the algorithm of the rapid testing, where written and or verbal consent has been obtained, the rapid HIV test should be carried out with a finger prick using an approved testing kit. If the first test is negative, that implies non-reactive, the client is considered to be HIV negative and should be given post-test counseling and encouraged to repeat the test 3 months after the negative result to exclude the possibility of the client being under the window period. If the first rapid test is positive, that is reactive, a confirmatory HIV test, which is a second rapid test, should immediately be performed from a second finger prick utilizing a different rapid test kit product. A client is considered to be HIV positive if the second rapid test is also positive. A record should be kept and updated on all identified relevant indicators. The client must then be given the results by the counselor, given post-test counseling in the language of choice of the client, and referred for appropriate individual services, especially for CD4 cell count test, TB screening, clinical staging, pre-ART, and wellness management of HIV-positive clients. If the two rapid test results are discordant, that is, the first rapid HIV test is positive and the second rapid HIV test is negative, venipuncture should be performed. A specimen of blood should be collected and sent to the laboratory for HIV ELISA antibody laboratory test. This should be explained to the client. And the results of the ELISA test should be considered confirmatory. In this case, the client should be asked to return within 5 days of the laboratory HIV results following the completion of the ELISA test. The importance of coming back for the results should be stressed. Rapid test demonstration. I am now going to provide an overview of how to conduct a rapid test. It is easy to give an incorrect result in a rapid test because different rapid test manufacturers all require different amount of buffer, blood, waiting time to be used for the test. And if one does not carefully read the instruction of the specific test and apply these instructions, you give a client an incorrect result. For an example, for a determined test kit, it requires 1 drop of blood, 1 drop of buffer, and 15 minutes to run. Whereas Unigold requires 1 drop of blood, 2 drops of buffer, and 10 minutes to run. In conclusion, it is important that HIV rapid testing is done correctly. It is important that the appropriate amount of blood, the appropriate amount of buffer, and it is actually put into the test kit, and sufficient or the specified time is allocated to allow the test to run efficiently. With regard to reporting, the results of the rapid test must be recorded on your lab form. These results will be compared against the lab results for accuracy of the testing. And regarding the quality assurance of testing is defined as those strategies employed by HCT services to ensure that the final HIV test results are correct. These include the proficiency testing, which will be done bi-weekly. Infection control procedures should be adhered to at all times, as well as observations that will be done by supervisors.
Okay, now since we have done the pre-test counseling, we'll be doing the actual test itself. Okay, and right here we have our linen saver. It is important to have this as it is a very clean procedure that we are doing. Okay, here we have our determined test kit, which we use as test for testing the first test, right? And should this be positive, we use this, which we call the Unigold test. It is extremely important to check on the expiry dates as well as it also, but related to the results itself, okay? And also the expiry date for this determined test, which we've also checked, it is here. It's still safe. It expires on the 2017, second month on the 8th, okay? And here we have our lancet, which we use to prick, and it is a needle, therefore when you discard it will have to go into our sharps container, right? And also this is our capillary tube, which we use to draw blood from the finger when it's pricked. You have to fill blood right up until that line or just below this at the second line, and also because it's glass needs to go into the sharps container. Okay, and here we have our buffers. This is the buffer used for the determined test. And this is the buffer that is used for confirming should the first one be positive. Okay. And then first and foremost, before I do the actual testing, I'd have to clean my hands with the hand sanitizer. And because we will be touching blood, it is important to use gloves. Now, the determined test has a foil cover that you will need to peel off, okay? And this is the actual test underneath it. Okay. So before I prick the finger, I would have to clean it with the alcohol swab. Okay, there you kindly have your finger. Okay, which finger? It is important to also ask the participant which finger they feel which is comfortable for them to use. Which finger would you like me to prick?
Middle one.
Middle one. Okay. So in order to get a good blood flow, you'd have to milk the finger so that you can get a good blood flow. And then you'd have to wipe the finger. Okay. And then you'd have to break the seal of the lancet. Okay. And it is important that you do not prick on this side of the finger. You'd have to prick on either side of the fingers. Okay. Also, it is important to reassure the participant that it is a little bit painful, so they would need just to be patient. It says a little bit painful, so okay. Okay. And now, what is also important, you will need to wipe out the first drop of blood, wipe it off and discard. Okay, now you use a capillary tube to draw the blood from the finger. Okay, and you ask the participant to hold. Please hold. Okay, now I'll put the drop of blood onto the tester.
Good. The next one. What's the next one? With the timer. When you're
Okay. You then discard what is left over. Okay, as it was said earlier, that you need to time the test. Okay, it is 15 minutes, and then you add your one buffer, your one drop, and then you start your timer. So now we'll be waiting for 15 minutes for the test. And it is also important that you do try and block the test so that the participant does not see the results, and you can actually talk to them whilst the test runs. 15 minutes are now up, and the test is ready to be read. There is one line on the tester, which basically means that it's a control line and the tester is working. If there were two lines, it would mean that it is positive, which means that antibodies were found.